Trendspotting, building robust healthcare systems. I'm delighted to be joined by Dr. Rakesh Suri, who's President and Chief Medical Officer of Fountain Life in the United States of America. Rakesh, thank you very much for joining me today for a lovely one-on-one chat. It's nice having these fireside chats.
Thrilled to be here.
Thank you very much.
Looking for the fire.
It's a sort of pretend fire. Sometimes at these events you have a sort of pretend virtual fire behind us, but not today. We don't need that. Given that the panel, the discussion, Rakesh, is called Building Robust Healthcare Systems. What is robust when it comes to healthcare systems? Let's decide what it is, let's describe it, and then we'll move on from there. So what are robust healthcare systems?
Well, it's really appropriate. We're in the UAE to be speaking about this because the late Sheikh Zayed, the founder of this nation, said that the wealth of a nation is in the health of its people. And therefore, I think that's really something that's top of my mind every time I speak about healthcare, resilience and growth and integrity and robustness. And if we remember a robust healthcare system as one which keeps its people well, happy and productive, then it truly supercharges a nation's ability to thrive, as we're seeing in the UAE.
Who does it better? Clearly the UAE, because you've mentioned the UAE, and here we are in Dubai, so that's wonderful. So tick for the UAE. Who also would you put in that camp? I wonder how many there are of robust healthcare system.
Well,
let's name and shame.
So I'm gonna gently sidestep that one, but I will answer it in the following ways. Yeah. I mean, I'm a student of healthcare. I was privileged to be in the UAE for 7 years, a part of the remarkable team building, growing, and then leading Cleveland Clinic Abu Dhabi, which is now on the global list of the top 150 healthcare organizations around the world, all within 7 years of opening. So as we step back from the areas that we're specifically involved with and try to look at trends globally, there are a few things that have emerged in defining the healthcare systems of the future. Number one, as in any business, there has to be a great vision. We have to set a vision for ourselves, and healthcare is no different. We have to set a vision of what we seek to achieve together. The second is that we need to rely on the latest science. And science is progressing at a light speed, quicker than it ever has before. You know, approximately 30 years ago, medical science would double every 50 years or so. Now it's doubling every 3 to 4 years. And it's being supercharged by two specific trends. One is AI. There's some people who think that businesses who are not fully leveraging AI by the end of this decade will be out of business. And the second is biotech itself. From the biologics to the technology are accelerating at an incredible speed, and literally innovations are in our lap every day. So reliance on the latest science is number two. And then number three is an ability to disseminate learnings through the population, from the practitioners to the ecosystems and the systems and processes to the people who are benefiting. So vision, reliance on the latest science, and the ability to align the ecosystem.
So those are the tenets, those are the things that a robust healthcare system needs. What did COVID, Rakesh, teach us about building robust healthcare systems? Because it taught us a lot. Have we learned the lessons?
So the UAE is a fantastic example of learning on the fly, it being nimble, creating a vision, relying on the latest science, and then having the population participate in driving a successful outcome. So COVID taught us so many things, but let me give you a couple of vignettes that might be interesting. So as we were standing in our daily safety huddle in Abu Dhabi, as we do in lining the leaders across the organization, we started to notice little pings on the radar of strange illnesses that were heretofore undefined. So what does that mean? People arriving in Dubai from the Far East, from China and other countries with a strange respiratory illness. So we didn't know what this was. Was it SARS? Was it MERS, Middle Eastern Respiratory Syndrome? Were they bad cases of flu? We simply didn't know, and all the tests were negative. We didn't have the testing to be able to diagnose what the heck this was. So we gathered our leaders together, and we crowdsourced our information around the world and derived the code from one of our colleagues in a country I won't mention right now, and devised our own PCR to be able to detect disease. So point number one was we established a vision about what health looks like, health for our patients, protection for our staff, and our communities and our society, and then we relied on the latest science. And then once we figured out that we could diagnose this with PCR, and we couldn't get PCR machines at that point. They were literally sold out, and the reagents were out of stock. Then we were able to, once we're able to gather the appropriate supplies and bolster the supply chain, we're able to disseminate PCR across the UAE. And then the third one was we were short of PPE, protective equipment, that we had never before seen in medicine. So again, we needed to really align our ecosystems and protect not only our caregivers, but the population. So what we learned through all of this was the following. We could no longer feel safe in our homes, regardless of where they are around the world, when any member of our global society was at risk. We are only as safe as the least protected member of our global ecosystem. That was a profound realization, because for decades before, we would see the world as first world, second world, third world, and it was a second world problem or it was a third world problem, but it's not going to affect us. That illusion was blown away in the early days of COVID.
So how do we build on that now that we have that knowledge, now that we have that experience of dealing with the pandemic, some more successfully than others? How do we build this robust healthcare system, whether it's in a community, in a country, or in a region?
Many things are different coming out of COVID, from the finances that we're speaking about in many of these meetings, to the disruption in supply chain, to historic resignations, to thinking about what's next. So how do we do things differently? I think that we as communities and as nations and as networks globally need to really think about what's important to us. And if we focus on the health of a population driving the wealth of a nation, I think we're in the right direction. So then we start to ask ourselves, well, what is necessary for the health of a population? Well, first is understanding what the determinants of health and wellness are, and being able to disseminate these through our communities and our nations. That's number one. Number two is we need to be able to advance diagnostics so that we understand where we are in our health journey. Then the next thing we need to do is to be able to reverse any conditions that are reversible, and to be able, or cure them, and then optimize people going forward. And finally, we need to find a way to pay for it all. Because the other thing that has been a part of the economic collapse of nations and sections of the world has been the inability to pay for and sustain.
It all sounded so
care.
doable until you said, and finally, we need to pay for it all.
Yes, that's right.
How do we pay for it all?
We need to go back to the basics. We need to understand which things we're doing in healthcare that drive outcomes, and which things we're doing that drive margin for members of the ecosystem that may not be directing the funds back into that virtuous cycle of improving
So
an
waste
outcome
and
for all.
inefficiencies.
Waste, inefficiencies, and members of the ecosystem that are driving margin and taking it out of healthcare and not putting it back into the health of a population or a nation.
That's shocking that that's happening. But we know it's happening.
We do. There are misaligned members of the healthcare ecosystem, and we're not here to blame and shame today, but we're here to stand back, just like any business, and to understand where our costs are, where our revenues are coming from, and the ability to generate margin, and then understanding what we do with that margin, and if we're thinking about healthcare, how we ought to reinvest that margin into improving the health of all.
Let's come back to AI, let's come back to data science, let's come back to technology, the advances in technology, some of the things that you're doing
Yes.
at Fountain Life. Tell us what you're doing. I mean, go on the website, you read it and you think, wow, why isn't this available in every street corner in the world? It isn't, but you're trying to achieve that aim. Tell us about what you're doing and why it's so important, and this seems to be the way that healthcare is heading.
So I'm a practicing heart surgeon, and it really is a means of keeping the fingers on the pulse, literally, of what's going on in our bodies and our healthcare system. For decades, we've seen the sad story repeat itself of a patient coming in with a catastrophic heart attack, only to be then turned into the cath lab, diagnosing severe coronary artery disease. And even if we're able to bypass or stent these conditions, oftentimes the heart is irreversibly damaged. So we can restore blood flow much too late. And this degree of scarring then leads to a suboptimal contraction of the heart that leads to diminished outcomes and the inability to return to normal life. It's a sad reality that we were able to intervene only too late. And the same is true of heart valve surgery. I've spent my career working with teams where we learned how to repair the most sophisticated heart valves. But yet, even though the valve's repaired and the heart's beating normally in terms of its valvular capacity, the heart often suffers from failure and an inability to return to its previous robust level of functioning. These small examples, translated with our experience in hospital leadership, lead us to understand that there's a delay in diagnosis that affects not only communities but nations and whole sections of the globe. We simply don't understand what's going on inside our bodies, and then when we do, we're often too late to restore normal life expectancy. So at Fountain, one of the main reasons that I was humbled to join them is they've set their vision, we've set our vision on bringing advanced diagnostics powered by the latest artificial intelligence and rapidly evolving science into the hands of clinicians and patients now, a decade before it would be available in traditional healthcare systems. Then we take that data and those diagnoses, and most people have a diagnosis that impacts their life immediately, even healthy people. These are healthy, pre-symptomatic individuals, and then we utilize this data to diagnose the condition, to reverse or cure it, and then optimize people moving forward. Now, this isn't all occurring in a data vacuum. It's quite the opposite. We're focused on taking the data, itemizing it into discrete data elements so that we can put it into data lakes and data ponds and be able to utilize advanced analytics and artificial intelligence to derive insights. Then finally, once we have the thesis for diagnosis and optimization proven, we teach, we disseminate, we share these learnings, and then drive it into a self-insured captive insurance platform so that we can take the savings that we derive from early diagnosis, preventing that metastatic cancer from happening, and drive those savings back into a virtuous cycle of paying for the care.
What are those savings?
What are those savings?
Yeah, I mean, give us an idea of how much you're saving, how much the healthcare system is saving by this proactive approach rather than reactive approach.
We think that the savings, of course, it depends on the age and the type of population we're speaking about, but we believe that the savings could be in the range of 20 to 30%. And we all know that with healthcare budgets increasing and being an inordinate amount of those funds being spent in the last years of life when it's too late and people are incapable of being restored to a normal, what we call health span, not only years, but healthy years. When we drive those into patients' lives and our clients' lives early on, we restore and maintain that ability to participate fruitfully in their lives and in society, whether it's their jobs, their families.
I think on your website it says, be 100 but feel like a 60-year-old. Is that what it says? That's quite enticing.
Yeah, so as a doctor, I've never fallen into the trap of predicting when a patient will how long they have to live. It's often a question we're asked in medicine, and we often say it's in the hands of the divine, where we just read the signs along the way and do what we can to optimize things. And it's the same in lifespan. I prefer not to focus on the number of absolute years, but the number of healthy years, so that we can really focus on keeping people alive in their preferred state of being for as long as possible. It's funny, when you ask people how long they want to live, who would want to live to 120, I mean, oftentimes in rooms, people don't put up their hands that they want to live to 120. And as a heart surgeon, I've had patients say, I don't want surgery because I'm 100 years old.
Because the quality of life.
But if you could tell them that they would enjoy those extra years of life, functioning at their best, that's a very different value proposition. We've never before been able to do that in medicine until now.
And are you confident we can achieve that? Some of these healthcare systems which are ingrained in all these inefficiencies and these ways of doing things that seem to be stuck in decades gone by, are you confident that we are moving in the right direction, especially post-COVID?
Well, I'm confident based on the remarkable people who have come together to make this happen. Our founders, Tony Robbins, Peter Diamandis, and Bill Kapp, amongst other remarkable leaders and team members who have all come together in Fountain, along with our ecosystem that we're partnering with across the globe at the latest academic and longevity institutes, number one. Number two, I've devoted my career to this now. I've voted with my commitment in my career and my ability to work amongst the team.
Just on the partnerships front, and that's important, isn't it?
Partnerships.
Tell us about the importance of partnerships for a sustainable and a robust healthcare system.
So partnerships are critical on all fronts, and what I was going to go to next is we see this as a blue ocean abundant space. So many people in life, whether it's finance or many of the things we're speaking about here at this conference, we think about it being a zero-sum game. We don't see it that way. We see this as jumping outside of the traditional red ocean or marginal improvement ecosystem, getting into blue ocean, where there's really a vision where we can create a new pathway for us as humanity, bringing in the partnerships, whether it's through diagnostics, biotech, health tech, artificial intelligence, et cetera. So partnering on that front, partnering on the data side to be able to analyze our data real time and get it in the hands of what we call a digital twin. So our physicians and our patients can manage people live from the palm of their hand. And then partnering with insurance. It's actually extraordinarily rare for providers and payers to partner. And where they have in the past, they haven't necessarily driven forth the value proposition. So partnering on the diagnostics, partnering on the data, and partnering on the insurance.
Yeah, we've got a minute or two. Any questions from you, our wonderful audience? Yes, gentlemen, lady there, lady at the front. Was that you?
No.
Or yeah, do you want to ask a question? Or? Oh, you were just waving your hand. Gentleman there, so you can keep waving whenever you want. We'll just wait for a microphone so we can all hear you. We're just going to bring you a mic. Thank you, sir. Here we go. Tell us who you are and fire away.
Hi, my name is Lakshmanan. COVID has obviously brought a big divide between the rich and poorer nations further. Do you think with all of this development in this healthcare tech, the costs are going to be pushed up and the poorer nations continue going to be poorer?
So it's a great question, and it's not about money alone, meaning the wealthiest nations, as when you look at GDP, haven't necessarily done the best from the perspective of COVID. And to really go back to what we said about the three things that we derived as important elements to focus on for that pandemic, but forthcoming pandemics. The experts predict that pandemics will, let me put it this way, infectious diseases that are capable of causing pandemics will continue to come before us. And this is not unusual when we look back at history of medicine and the history of population health. So the question is, are we ready for the next pandemic? And which countries will be capable of navigating it with the greatest degree of success? And success being the health, happiness, and prosperity of communities and nations, right? So let's just set the tone. So then we go to visionary leadership. We have to elect and support leaders that we believe in. How many countries around the world do we look at and we say, you know, I don't trust our leader, and I wouldn't trust that person to be in charge of my health. So how can we set a vision for the nation? So visionary leaders are a mandate. And if there's one thing we can do as individuals is ensure that we have the right leaders leading our communities and our nations. The second is that we need to be a part of this democratization of science. Science is now present on the web in a way that's never before occurred. You don't go to medical textbooks oftentimes to gain the latest insights, you Google it. It's been democratized and made accessible to the world's population, as well as through ecosystems like OpenAI. So leveraging the latest science. And the third is we need to align populations. And when communities become stronger, whether they're families, neighborhoods, parts of countries, or even hemispheric alliances, then we can bond together. So it's we focus less on the have-nots and expand with greater potency the haves to create a meaningful impact on humanity.
I think that's a brilliant way of wrapping this up. I want to say a big thanks to Dr. Rakesh Suri for a fantastic... It's sad that we've got to move on to our next panel, but please do approach Dr. Suri afterwards. Sorry, we've got to move on because I'm the time police. I've been told I have to move everything on. But a big round of applause for Dr. Suri. Thank you very much indeed. Thank you.